think I can now start the recording, and yes, we are now recording. So good morning, everybody, and thank you all for being here with us today. It's really, really great to have this as the first session of the Health Data Forum Global Hybrid Summit. So as you all know, the summit was supposed to be happening in these beautiful places we have in the back. So we were supposed to be in Tagus Park, which is this beautiful location you see here in Oeiras, and also having a summit dinner in Hotel Mirage in Cascais. So unfortunately, this is not going to happen due to coronavirus, but we will not be deterred by that in order to have a meeting, a virtual meeting, a place for human encounter, as I expect we will be able here to be finding and improving our human connections, our human relationships with other colleagues that we are not able to be physically present, but we are virtually present. And virtual does not mean distant, I hope. So it's really good to have you all here. A special thanks to our sponsors that are allowing this summit to proceed. And one of them is here right here with us, Lucas Chiofi from Kiko Chat is kindly generating this platform for our own use. And all our supporting partners that are making this possible. Also, I would like to acknowledge the presence of Pedro Cid, which along with Laura Ringard will be session co-hosts for these 3 days. So we're going to be have the pleasure to host you on this global summit for the rest of the days until Friday. And without further ado, I would like to introduce the session leader for this session. And this is Bleddyn Rees. Bleddyn is the deputy chair of the European Connected Health Alliance, more known as ECHAlliance. We are also proud members of ECHAlliances. Pedro Cid from Digital Health Portugal is one of the member ecosystems of the ECHAlliances, with whom we have a very close relationship. And also further in this summit, there will be other interventions from ECHAlliances. But it's very we are very fortunate to have this important workshop just opening the global summit. Bleddyn Rees is also an expert lawyer in healthcare, so that's another important affiliation that he has. And without further ado, Bleddyn, up to you now to run the session until 1 p.m. UTC. And I wish you a very fruitful session. Thank you for joining the Global Hybrid Summit.
Thank you very much. So good morning, everyone, and welcome to this panel on trust, citizen empowerment, and the role of digital literacy on health data sharing. So I'm going to very quickly introduce the distinguished panel that I have the privilege of moderating this morning. So first up, Diogo Martins, who is a EU International Digital Health Projects Coordinator at SPMS and has an MA in Health Information Systems, as well as another degree in Health Equipment, Electronics and Medical Devices. And then Carola Schulz, who's a research consultant with Empirica in Communications and Technology. She is an economics graduate, and Empirica is the coordinator of Digital Health Europe, a little bit more of which I'll explain later. Next up, Dipak Kalra, who is the president of the European Institute for Innovation Through Health Data and a professor of health economics, and someone who has over 20 years experience in this whole field. Next, Mara Dioconu, who is a senior EU advisor at Norway Health Tech and a graduate in communications and public relations. Next, Anna Silva, who's a patient experience project manager at a Portuguese hospital. And then Juliana Sa, who is appearing in her scrubs, I think, and is a doctor currently in the hospital and may be being distracted by real world practice. And then finally, Carina Dantas, who is the CEO of Shine to Europe, chair of Net4Age, and an international projects manager at the ECHAlliance. So Mara, Anna, and Juliana are not involved in the Digital Health Europe project and will bring some independent perspectives to some of the work that we're going to be sharing with you on this panel. But now I'd just like very quickly to set the scene. So in my view, technology is often overpromised and under-delivered to healthcare professionals and citizens. I've seen a slide used by a couple of people that talks about the invention of the radio and how the radio was going to transform the delivery of care by healthcare professionals, just as an illustration of the point. So the question is, will digital and health data fall into the same trap of overpromising and under-delivering? The importance of data is clearly seen in the summit's agenda. There's AI, COVID, system architecture, interoperability, and EHRs on the agenda. The link to all is data and data access. At the moment, the pandemic is shining a very bright light on the use of data, analytics, and when data is not available, either in country or across borders. So as we were just speaking about before we started the panel, this opportunity presented by the pandemic, will it transform the use of health data? So it's a fascinating time in Europe at the moment with a new commission and policies, especially around the European health data space and the EU for Health programme. Data sharing governance and digital literacy have an important role to play in the development of these new policies. The summit asks, how can big data empower health and healthcare for revival and renewal? This panel will start to answer that question. So a little bit about Digital Health Europe. It's an Horizon 2020 EU funded project with 17 partners across 10 countries. Digital Health Europe is part of the Digital Health and Care Innovation Initiative of the Digital Single Market Strategy. It's part of the work for the digital transformation of health and care with a focus on citizen secure access to and sharing of health data across borders, digital tools for citizen empowerment and patient-centered care. So a little bit of signposting for you about how the panel's going to work. So we're going to start with two presentations. So Carina is going to be talking about citizen-controlled data sharing governance. Then Diogo is going to talk about the role of digital literacy in health data sharing. We're then going to have some panel discussions about the challenges in relation to both of those topics. And then we're going to open up to questions from, if you like, the virtual floor for those of you attending. So then we'll have a quick wrap up and look at sort of next steps for where the conversation takes us. So I'd like now to pass over to Carina for the first presentation.
Thank you, Bleddyn. So thank you all for being here, and it's a pleasure to be joining the panel. Let me just tell you first that for some reason I have been kicked off the room for 4 times, so I do hope that I will keep stable during the presentation.
I don't know whether anyone else can hear her, but Carina's frozen.
I think we lost her. Yes, we lost Carina.
Yeah, she got frozen, unfortunately.
The wonders of technology.
Yeah, so I think we can wait 1 or 2 minutes, and of course, Bleddyn, if you want, I can take the floor in the meanwhile.
Let's give her a minute to dial back in. She's showing us a participant again.
Yes.
Ah, yeah, there we are. Welcome back.
It's still frozen for me. I will just use this opportunity when we are waiting for Carina, just to let you know that the materials for this session, including the presentation, recommendations in the PDF, and also the link to the Digital Health Europe are in the breakout session 3. So during the break, you can go there. We are now in the main space, and also for those who would like to download it, it's all there. And hopefully Carina will be with us back.
Karolina, thank you very much for that.
Thank you.
Okay.
Yes, Carolina, and thank you for this. It's very interesting that there's an expert user of Kiko chat already with us. So this is a suggestion for you, Bleddyn, if you wish to do after a round of plenary considerations in main room. If you want, after the break, go to breakout room 3. In breakout room 3, you will be able to access the materials that Carolina has mentioned. And even, I think, is there a note-taking page there, Carolina?
There is no note-taking page, but there is the agenda document, which is actually the Google document that I owe. So I actually can do the note-taking there, and I can open this for everyone if you also want to. It's at the moment everyone has the viewer rights, but I can open this if you would like to also contribute.
Exactly.
So I can do it right away. Of course, this would mean that we would now, if you would like to move to the breakout session 3, we would have to drop out from this call and join the other Zoom call in the breakout session 3. I don't know if we want to risk that.
It's up to Bleddyn if he wants to make a break in any point in time.
Right,
Maybe
of course,
we could
yes.
convene that after the break. We will all meet in a breakout 3.
Exactly.
And then from there, you could proceed the discussions, and you could then, Carolina, do like the note keeper of the discussion elements. It's entirely up to you, Bleddyn, to decide if you want to make. Did you plan to do a break in this session, or
no?
No.
Because
no,
90 minutes is a lot of time online, right?
Yeah, but there's so much content, okay,
Okay.
and it's going to be entertaining. It's going to be entertaining.
But nothing, a bio break you could do, right?
Yeah. We can pause for a minute for a bio break.
Okay.
Karina,
so after that pause, then breakout 3, everybody, right?
Yeah.
Karina, are you there?
I've let in. Yes, I've changed network 3 times, including my data from the phone, and I'm always kicked off of the room after 2 minutes. So I'm not sure what is going on, but I don't seem to be able to stay here. I will try again. If something happens, maybe you can go to Diogo and I don't know what else to do, because I changed computers 2 times and networks 3 times. No, I don't.
Oh, okay.
I don't see any other solution.
Maybe you will. We love to see you. Maybe you want to switch off the video to free a bit of bandwidth.
Yeah, sure. I will try to share the screen and see if we can proceed.
Yeah, please do.
Okay. Good luck.
Thank you. Okay, so I'll try also to be brief to see if I can stay in long enough to present. As some of you already know and Bleddyn introduced, we have been developing work under the area of citizen control, data sharing governance, a part of it under the Digital Health Europe project. And this is a bit the outcomes of what we are going to discuss today. And it's a work that was done with SPMS, EuroHack and H-Platform Europe. So from the work we have been doing under this area, we tried to collect, let's say, 4 challenges that are also connected to the area of digital literacy and of empowerment of citizens and professionals in connection with the use of digital tools. So the 4 challenges that were highlighted for the discussion today and that Bleddyn will pick up later into the part where we want to be more interactive, are
Okay, we're still seeing the screen, but obviously we've lost the voice. I still have Carina showing in as attending. So let's just see if... no, she's gone. I think she's, oh no, she's... Okay, while we try to resolve that, should we switch, and Diogo, can you take over with your presentation, please?
Yes, I will try to do my best. Let me share my screen. I hope that you can hear me clearly. Now you are seeing my own laptop. Just 1 second. Can you see my screen?
Yes, I can.
Okay, super, great. Thank you so much. Good morning, everyone. Thank you so much for this opportunity to participate in the event and to give you some insights about how citizens secure access to and sharing of health data. For us, it is very important that we keep the opportunity to discuss about one important milestone and one important pillar in this digital age, that it is digital literacy towards an exchange of health data. Of course, this is part of a full work program under the Digital Health Europe that Bleddyn have explained to you before. I'm going to give you some slide flavor about what we're going to discuss. So what I'm going to give to you is some insights about what it is the work package for of Digital Health Europe and how it touches upon on the topics that we are going to discuss today. Some context about the landscaping of what it is health data sharing, what it is digital health literacy, and of course the challenges that we had ahead of us, not only as a citizens, but as well as a healthcare professionals. The main achievements that we have conducted so far as a project and as a work package, some results and challenges. In the end, I will open the discussion with 3 questions to the audience to see what are the different perspectives about the adherence of digital health literacy upon the citizens, professionals, and policymakers. So on today, about what it is the work package for and what deals with it. So the main objective of Digital Health Europe under the work package for it is to establish a functional multi-stakeholders community in line with the objectives set up by the European Commission on the digital transformation in the healthcare. This was a priority for the Commission to have and to provide the right access to the healthcare providers and to the citizens to health data. For that, it is very important that we bring together EU expertise, national authorities and entities, regional initiatives, and the relevant projects to be a cornerstone to heighten the citizen access to health data and, of course, to enhance the continuity of care by using the different tools at the disposal of the citizen and of the patient. What we want to talk in this specific work package it is how can we identify the different enabling factors to really unlock the full potential of digital health and the useful of it on our daily lives. Some examples are, of course, the digital literacy and the citizen trust on the digital tools and in the way that we'll have this preventive work on their daily lives. In terms of adoption, what we really need to touch upon, it is to facilitate the adoption of the European Electronic Health Record exchange format, that it is a recommendation set down by the Commission in terms of the exchange of the different formats and the principles that is going to follow this access by the European Commission and by the Member States in which regard for this topic. This is very important if we want to have a common approach on implementation of EU policy and to be aligned with the priorities for the Commission. What we want to achieve in the overall work package, where Carina and myself we touch upon, it is in these three main outputs. It is to set up recommendations and guidelines on the citizen-controlled data governance models, and of course the data donation campaigns for health. This is going to be a very important uptake if you want to achieve and work towards an European health data space. The second aspect in terms of the recommendations, it is how can we facilitate the adoption of interoperability standards towards a stabilized and harmonized ecosystem of health data. As a robust method that we want to apply, it is to provide a white paper on the better citizen and access and control of data. And this is going to be lies down the foundation on the topics that I mentioned to you before. So in terms of the presentation common models, the most important topic that for us in the present situation, it is that the most citizens have limited access to their health data. Health data is often not traceable and it don't have higher level of quality. The third aspect, it is that health data are sectored out of different places and available from different healthcare professionals. And of course, this will affect negatively the treatment and the follow-up by the patients, by the citizens, and of course, the working methods by the different healthcare authorities and professionals. For that, it is very important that we keep up these three main principles. The citizens should have access and secure to electronic health records. It is very important that the citizen continue to have and should remain the control of their health data on a secure and a private way. And of course, this will be in line with the data protection legislation, such as the EDIS regulation, the NIS directive, and the GDPR in the different domains. One important uptake when I'm going to talk to you about this work package, it is about the context and how do we see this perspective. Citizen secure access and sharing of health data, it is really a broader scope. And for us, it is very important that we take onwards the citizen perspective on this topic. Of course, it is very important to touch upon on the governance perspective and to see how can we identify and promote the adherence of digital technology and sharing of health data between the different stakeholders. We cannot forget an important uptake in terms to have data governance and data donation towards to have concrete data to be used between the different healthcare institutions, and of course to be reused by researchers, by public health authorities, and of course towards an innovation. In the end, we cannot do this if we don't look on the technical perspective and we follow these interoperability standards and we follow the flow of the data between the different healthcare organizations. Now jumping to what we have achieved as a project so far. So we have conducted some initial roundtables and workshops about what are the perspectives in terms of the multi-stakeholders, where is the information with, what are the barriers and the enablers for the secure access of the data, and what are the legal issues that we have in terms of this topic. We have conducted a deep research and an analysis between the different stakeholders involved on it under different projects of Horizon 2020, and of course with the experts of the professionals, with the different authorities and with the different stakeholders in a multi-channel level to really to receive the community of the feedback, and of course to have multiple perspectives from the different stakeholders and actors. So this is the way that we conduct the document, that we conduct our work. It is to come up with the community, to see what it is going on, to come up and talk with the people like we are talking here today. Our main expectation, it will be to analysis of the different projects and initiatives used at the EU level related to the citizen security to access and sharing of health data. So in this analysis, we do saw these 5 main domains are very important in this topic. The access to health data, engagement strategies, access tools, the state of the art between the different member states, and how can we benchmark, and of course the topic that we are going to talk here today, the digital health literacy. In terms of results, in terms of the vision, what we want to achieve that a citizen, a European citizen, should have secure access anywhere in the EU to a comprehensive electronic health record of their own data. Not only the data that is stored in the hospital or in the healthcare sector, but as well the personal health record. The information that I do have in my phone, for example, the information that I do have in my watch, or information, or for example, the information that I do have in the medical devices or in the internet medical of things. We need to keep in mind that the citizen should remain in control and should be able to share this information to whom he wants, and to do it on the private environment. Digital healthcare professionals need to take care of this type of information. They need to improve the patient individual care and a personalized medicine. And of course, to enhance the global healthcare innovation by providing a better understanding of the diseases, and of course, the advance the development of the new engagement strategies. For that, we came up with some enablers and some barriers that we would like, let's say, to discuss later on. In terms of the enablers, we do see that everyone is eager to really to unlock the full potential of digital health by have user friendliness of the different softwares and tools, to have higher level of digital literacy. And of course, this is a little bit confusing to have an enabler. It is high digital literacy, and the barrier it is. Of course, this depends on the population, depends on maturity of the country, and of course on the citizen and on the individual itself. The availability of mobile technology, the financial incentives by the private and by the public sector, and of course, how can I trust on the secureness of this data? The barriers that we identify in our work, it was about the lack of digital literacy, the resistance of change, not only by the individuals, not only by the healthcare professionals, but as well by the different healthcare entities and the cultural environment that we do have in the healthcare sector. The different interoperability issues, that the legal ones, the semantic ones, and of course the most technical ones, and of course the lack of dissemination of what works and what doesn't work, and the different levels of engagement. So coming up with some results. So we do saw that that we had some weak points in terms of adherence to digital tools, and we saw that there was a lack of involvement of healthcare professionals when using these digital tools. Of course, this depends on the maturity of the systems, depends on the user friendliness, and of course, on the cultural of the institution. The lack of the good examples from the professionals. So really to have the healthcare professionals to be the game changer and to be the movement that will give good practice and good examples to the community. The lack of the awareness and preparedness to the use of digital tools to access and share of health data, and of course, the few or inexistent initiatives to promote digital health literacy. And this is what we found in the document. This is what we found in the desk research. This is what we found from previous sessions. What we want to touch upon with you in the next 10 minutes, it is to really to see from your perspective, from your background, from your current position in your organization, how can we understand what are the challenges that we are going to face in the next upcoming years, not only due to COVID, but I think COVID came up as an accelerator for the digital health, and I think we need to build a strong community. So for that, I will open the floor for answers to these questions to the different panelists that we have today. And for that, I would like, let's say, to answer to some of these examples. Who should take the first step in cementing the importance of digital health literacy in professionals and patients? The importance that health professionals have in promoting digital health literacy and somewhat forgotten, and of course the people. they feel discouraged to be involved in developing their digital health literacy skills. So, of course, this is two perspectives in these two questions, and I would now pass the floor to Bleddyn to give, I don't know, some insights or to pass the floor to the rest of the colleagues. Thank you so much.
Diogo, thank you very much indeed. So great. If we keep that slide on the screen with these three challenges, and if I can invite the panel to address perhaps the first one. So who should take the first step in cementing the importance of digital health literacy in professionals and patients? Who wants to start us off from the panel?
Well, I'll jump in with a quick remark, if I may, Bleddyn. And that is that there are probably multiple answers to the question, because there's more than one first step to be taken. But I think there is an absolute prerequisite, which is that we are not going to be able to provide population-wide support for digital literacy without investment. And therefore, in a way, one of the very first steps has to be that agencies that have a responsibility for educating citizens, agencies that actually care about the benefits to all from more digitally literate patients, have to be ready to come up with the money. I know it sounds a bit blunt, but there are other actors, I would say, also need to be first movers, including patient organizations, educational bodies, public health bodies, many other bodies that would be closer to content or delivery, but none of them have spare budgets in their pockets today, especially in a COVID era. So we have to first decide that it's a worthy public investment, and that the people with some degree of control over budgets have to be ready to say, this is a priority. And it's not a competing financial priority with COVID. The opposite. It is actually a coping strategy for having COVID, because digitally literate patients will be better equipped to cope in a COVID era. That's my mantra on money.
I'm going to ask Juliana, because I know that she's passionate about education, what her view might be on this first question, this first challenge.
Yeah. Good morning, everyone. Can you hear me?
Yes, we
yes,
can.
We can.
Okay. So, well, for me, one of the most important things is to begin with educating the professionals from very early on their career. I mean, even medical students should have a clear plan about digital health, because professionals can really be motivators for their patients to use technology and other tools. So the trust that the patients have in their doctors, nurses, or other professionals should be the motor to begin and to go on from that. The other thing is that the systems to health professionals should be born in the middle of the work and the healthcare providers. Health professionals need to understand that is something that comes to help them, and not another tool that they should add on to their clinical work in their daily routines. So the professionals should be involved since very early in all the programming, designing, and so on of all the systems, so they can really feel that that is something that comes to help them, that is something that comes from real life, and this is not a battle between engineers and physicians or healthcare providers. So that's the two most important things. And a step that can be done to do that is really to define what e-health competencies health professionals should have, and that should be designed in the medical curriculum and other healthcare curriculum from the first day in the medical school.
Thank you. And that, do you think that it's achievable that we can create a curriculum in relation to digital health that is, or that ought to be used across all member states?
Well, that is not only achievable in my perspective, but the thing is the most desirable thing. We are not influencing what kind of education each country gives in their medical schools. We are just saying this is the minimum level required for your students to have. And not only doctors, I speak for doctors because it's my area, but of course other areas the same. We just have to put what is the least acceptable level of knowledge that professionals should have in order to work in their daily lives. And this can be done not only with one step, we can have several steps depending on what role the professional will have in the future. That maybe managers or will have to have other skills, and profiles can be created to each task and to each profile of the health professional. But the first step, I think, is to have the minimum requirement, and that can be to every country, and then the country can decide and can choose what is the best way they can to achieve the goal.
Thank you. And I'm assuming that for curricula, we could also see that taking place in schools, so that we're educating children from a young age, because they already have a lot of ICT training, so the digital skills are there. But it'd be very interesting to have the health literacy added to that, so that the people, because we really need both, don't we? We need both health literacy and digital literacy in order to make the transformational change that we want to see.
And what, may I just add one more thing, is that we cannot think that because this generation is in touch with technology every day in their phones, in their lives, and we should not assume that they have literacy only by having touch with the technology or just by using it.
Yeah, very good point. Anybody else want to chip in before we move to the second challenge?
Hi, here it's Mara. So yeah, just to enforce what Juliana was saying, I think that health professionals should act as a hub between the people, the citizens, their patients that are coming to them with the needs. And sometimes I met professionals that were saying, oh, well, I had patients that they were more digital literate and health literate in the new technologies, new sensors than myself. So they can, and then they can take that information and make a push towards the government to change the system, the health system. So I think that health professionals, they are very a key partner, a key element in an ecosystem where they can put a pressure on the health system, on the government to change some of their policies and how they act and how they see healthcare in the future, and also get the information for patients and give the information to patients.
And that's a perfect segue into the second challenge, which is the importance that healthcare professionals have in promoting digital health literacy. So you're making a strong point that they need to be the champions, if you like, of this and to bring about change. Anyone else have a perspective about this challenge?
Can I jump in?
Yeah, please do.
Okay, thank you. I would like to start by asking everyone to bear with me because my English is a little bit rusty. So I will have some examples for you for what is being done and is being developed in our hospital. So we have a project, a transformational digital project named OROS, which is part of the nationwide initiative from our Health National Care System, that is SNES without paper, which we had several initiatives. So one of them was to promote digital health literacy among our citizens by signing protocols with local authorities, such as several municipal institutions, and whose proximity to the population has a crucial worth and has a consequent added value. So I think we have a lot of good results, and it's part of our project in cementing the importance of digital health literacy in our citizens. And to do so, we also involved our professionals, our health professionals, and by giving them training in our digital tools, not only from our hospital, but from our health national system. So we think, and it's part of our goals, that this transformation can also be done not only in the hospitals, but also in our community. A little bit by what Bleddyn just said, into our schools. So I think we can start from that.
Okay, and I think we've touched on the third challenge around patients and professionals feeling discouraged or being unaware in digital health literacy skills. I mean, one of the things I'd say in passing is that Barclays Bank have a program called Digital Eagles, and they have been training their customers to avoid things like fraud. But during the pandemic, they've moved to training 500 care homes across the United Kingdom to allow the residents access to their families through digital communications. And I think that healthcare needs to also look outside of healthcare for those organizations that have an interest in bringing about digital education and digital skills building, which you can use without incurring costs for the healthcare systems. And I suspect that there's other financial services organizations that are also incentivized to build the digital skills of their customer base. So I think there may be more answers and more resources available than we might at first think. So can I, with that, Diogo, thank you very much. Can I move us on to Carina? So Carina, can we have another go at your presentation, please? Okay. Carina, are you there?
Is Carina there? Okay.
Okay, Caroline, have you got access to the slides?
Yes, the Carina's presentation was actually 2 slides only.
Right.
And in those slides, she lists the challenges and then the recommendations. I can, of course, go through them. I don't know if you can remind me, how was it scheduled within the session? Should we like stop after the challenges and discuss that and then go to the recommendations, or?
If you can start with the challenges, which I think which is what Carina was starting on, then go to the recommendations, and then we'll go into a discussion back to the challenges.
Right. So I'm sure you are seeing my screen right now.
Yes, thank you.
Right. So so where Carina was starting, this is part of the work that I was working with Carina on. I was supporting her. We within the work package 4 that Diogo was presenting, we work on the recommendations on the citizen-centric data governance, data sharing, health data sharing, and that was the survey, the desk study, also the interviews with the professionals. And there are several challenges that were identified within this process. You see them now on your screen. Starting from the policy and societal framework for citizen-centered data sharing governance model. What is this framework? Also, what are the needs in terms of digital literacy of citizens and professionals to ensure participatory models? So if we want people to drive this change, drive this transformation, to have those citizen-driven or citizen-centered data sharing models, what are actually the needs to ensure that actually people will be able not only to understand and use the data, but also to participate in this data governance? How can citizen-led data governance models respond to the current challenges? So the current challenges, meaning the societal, economic, health challenges. And which best practices and initiatives might be used as reference for benchmarking, adaptation, or adoption? Do we have any best practice of the citizen-centered governance models in health? Is it maybe something with the blood donation or some other initiatives? So that was on the side of the challenges. So a bit of everything from the different levels. And here we go. This is the dramatic, like now transition straight to recommendations. So when we were looking on what can be done and what can be recommended, and there is the whole document written on the recommendations. The summary of that is a document that is in the breakout session 3, and this is the summary of the summary. So we know, or there are like lots of voices, and already Diogo touched on that people should have more control over their health data, and also they should have more opportunity to actually share and use the data for the other purposes. But of course, there is also the need to increase citizens' awareness in regards to their rights. Of course, we have GDPR, we have Article 20 in GDPR, which is all about the data interoperability. We know that to some extent, technically, it's all possible. But actually, do people know about it? Do people actually know how to use their data for other purposes to get other services and so on? What is the governance model that is transparent, ethical, provides the incentives for data sharing, and protects the privacy? How is this model sustainable? So on the side of the recommendation, well, we need still more experience. There are some models that are emerging, but many have shortcomings, like, for example, the health data cooperatives and similar to those. So we still need to learn to trial and error. We still need to give ourselves the opportunity to actually approach this in the agile way, to develop, to test, to try. But at the same time, to, of course, still coming to the recommendation number 1, to educate, to build the capacity of the citizens to actually understand what is it all about, and that they will help us to improve those models. And of course, I'm sure that everyone who works with the data sharing knows this. Well, trust is a big challenge to overcome. Citizens are often and often also rightful, so afraid of sharing their data. So of course, we need to give the users the control over their data. Education is required, but also how to use this data in a safe and secure way, and privacy and security should be straightened. And someone said when I did the interview with an expert, said that of course we shouldn't be so freak out about the security. We should make sure that the data is being shared safely, because ensuring that the data will be secure is not possible. That if we want to have the data secure, we can just give up on this idea of actually collecting and sharing the data. At the same time, maybe adding to this discussion or just as an introduction, or sharing something that happened, for example, recently last week in Finland, where I am based, the health records of 40,000 people, the clients, the patients of the psychiatric center has been just stolen, released. People were getting emails and so on. So I think that privacy and security should be straightened. Probably we should not compromise on that if we want really people to trust that the data is being used ethically. Thank you.
Carolina, thank you very much. So perhaps if we can go back to putting up the challenges. Thank you. Yes. So I'm just going to ask anyone on the panel, does anyone want to start us on any of these challenges and want to make some preliminary points?
I would like to jump in here.
Yeah, please do.
Yes, I would like to make a connection to an event we hosted last week, which was a closed consultation with citizens and patients on the European Health Data Space. We had the honor of hosting a very small but diverse group in terms of country nationalities and in terms of conditions, health conditions they were living with, also hosted by and fabulously moderated by Dipak. And we had the honor of getting some real insights of these people who sometimes, who often were also advocates in this area and advocates for their condition on this point. One point I thought was especially interesting was if a data sharing model or a European health data space model should be an opt-in or an opt-out system. That is, should your data only be included if you explicitly consent to do so, or should your data be included automatically unless you opt out? So should there be a presumed consent? In the paper that, in the deliverable that Karolina just mentioned, there was a nice, interesting comparison to blood or organ donation. We know that organ donation in some countries is opt-in, like in Germany, and other countries it's opt-out, like in Spain. And the levels of consent are hugely different. Of course, you can't compare data donation to organ donation because there are a lot of major differences. But I think it's an interesting point, especially if we consider this keyword of citizen-centered approach. What is citizen-centered in this content? Does citizen-centered mean the citizens should have the maximum level of decision? This would point to rather an opt-in system. Or does citizen-centered mean that the citizens in general should have the maximum benefit from the maximum amount of health data? This would point, in my opinion, more towards an opt-out option. Because, of course, if only data is contributed to a European health data space of people who consciously opt in, there surely might be some selection bias of people who are especially interested in the topic, especially well educated on the topic, living with some special conditions they want to know more about. So these are very interesting questions related to this, and I was very lucky to have these insights from our participants last week, who in the majority pronounced themselves in favor of an opt-out system where you would be a default contributor to a European health data space with your healthcare data.
And Carola, in looking at the DHE, some of its summary, you talk about wanting to test some things at scale. And is this an area where you need more input, if you like, before you can reach firm conclusions about what citizens want?
Yes, definitely. Of course, since as I said, our group last week was rather small, around 20 participants. The deliverable that Karolina mentioned also included a large-scale survey in different European countries, but definitely there needs to be more large-scale experience to reach conclusions on this.
Mm-hmm. And I think like also Carola, this is very important what you said, like how do we really understand the citizen-centered? We like you just said that there are two understandings of the citizen-centricity, and I think that this is very valid point that each of us probably here in this session could have a different understanding. So maybe that's what Bleddyn added, what actually citizens want. And of course the citizens, we can have survey and we can have majority, minority and so on, but also to understand that of course people are very different and they can accept different you know, some are very happy of sharing everything and don't worry, and the others are very very yeah.
What I find interesting about this particular point is that organ donation is a member state competency, whereas the opt-out in terms of digital single market is an European Commission, if you like, competency. And there's an obvious difference or tension between them in terms of you can't opt out under GDPR, yet from a health perspective, what a lot of people might regard as a much more controversial thing, that you've become a compulsory organ donator unless you've agreed. It shows a sort of quite a different approach between the lawmakers.
I think that one topic on what you said. I think you have covered a very important thing. It is really a kind of a level of agreement that we need to achieve in the upcoming years that have these two perspectives. How can we really involve a patient that have these individual needs with have the possibility to use their data, keeping in mind that we need to ensure the privacy, the security, and the availability of it. And in order to provide this to the secondary purposes, and for example, for the research, to implement a new treatment or new medication or new ways to tackle that specific disease. So I think this is really the big question. It is really how can we go from this centralized personal care and how can we really unlock the potential of health data, not only between the national ecosystem and the national healthcare providers, but as well by the external and by the different EU stakeholders.
Excuse me. Hi, I'm George Matthew. I'm dialing in from the States. Sorry, I've been listening. I wanted to ask your all's advice since I only see the United States model, and obviously that's not global. When the point you made, Diogo, about being able to share the data and then use it for all these multiple uses. On our side, what we've seen is that there's a lack of trust in the system because of the fact that many of the patients are divorced from how those decisions are made with their data. They're not given a choice. They're not told. It's not transparent to them, and they're not consented properly. Many of the data gathering practices that are here, because we don't have a GDPR, except for possibly California, and even that's a little bit weak when it comes to health data. The data is typically gathered either physically through a global consent, which, you know, as you probably know, our HIPAA protections are fairly weak and 25 years old, so don't really protect the data being used by third parties. So it's been used several times. And then digital companies have their own end user license agreements on their apps that gather the data as well. And then it's used in secondary and tertiary markets and resold. And many people now in the time of COVID are having a difficult time participating and even helping. You know, American individualism aside, we could talk about that on a side channel about how pros and cons of that. But because of that, our participation in contact tracing for COVID-19 is very low. And with some of the behavioral health apps, what's been found is that, well, though many people are seeking counseling, the concern that data is being sold to third parties seems to be valid. So people are actually reducing their usage of these applications that might help them, but also might hinder them in the future. So I think the solution is in the seeds of what you and others have said, which is being extremely transparent with folks, giving them choice as to what happens with their data, and giving them agency to decide. not assuming that they can't make that decision. There was a framework point I wanted to make, Bleddyn, about potentially using data as a financial asset, but I think I've used up my time. Thank you.
Thank you. You've raised quite a few things there. Yeah, Diogo, do you want to? Yeah, please do.
It was just, I think, Matthew, I've seen it out, let's say, a couple of quick things that can shake a little bit the discussion here that I think we can uptake, and they are really an important topic. So like you have in the making a connection from the previous session to this one, I think you have really targeted in the bullseye. It is very important that we really increase the trust of the citizen on the digital services, not only on the public ones, but as well on the private ones. The second aspect, it is this behavior between the private industry, like for example Amazon, Google, and Facebook, and what role they have about, let's say, the data itself and about their data, and of course what is the type of understandings and the type of measures that the European Commission and the different member states can take upon. So this is a kind of a different perspective, and I think it is a good thing to really to have this outside perspective. That's always good. Thank you so much for that insight. Bleddyn, back to you.
Yeah, so there's a couple of things that George has raised that I'd like to sort of pursue for a second. So the first one that I'd like to ask the panelists is this notion of control by the citizen versus ownership, and what people's thoughts are on this contrast. Who's going to start me off?
I'll give it a shot, Bleddyn, if that's okay, unless somebody else wants to.
Oh, you go. I can go next.
Please.
No, please go.
Thank you, Karolina. For ownership, I think of it from the asset perspective, yeah, where I have a discrete ownership and rights over that tranche of data and where it goes, how it's used, how it may not be used. Control may be the same thing, but I may lease it, or I may give stewardship to someone else. One of the theories I've been trying to propose here has been hospital systems using their electronic health records as a way to bank the data so that they have full transparency and consent given to the patient, so that they may actually control where the data is going. But ultimately it's being held by the owner. The control of where that goes ultimately is held by the patient or by the citizen, so that they have full trust. I liken it to having a bank where you keep your money. You have full control over that money because it is yours, but you're trusting the bank to be its steward and to hold it and give it to you whenever you need it and allow you to direct it wherever you need it to go. Yeah. That's my basic definition.
Anna, was it you who wanted to come in next?
I think it was me. Sorry, my connection was unstable. Can I jump in?
Yeah, please do.
Okay, so yeah, I think like this whole discussion, of course, about the ownership and control of the data is on one hand pretty philosophical. You can try to understand it, like what really ownership means, and coming from this, it's that okay, you when you actually own and you transfer this ownership to someone else, you basically you can monetize your data and then you lose the control. And I think like this more European mindset or that is perhaps maybe more common in this area is that rather to give people the control of their data and that people can allow the other to access this data. Of course, there might be some financial incentives, and our survey shown that actually like people don't really necessarily want maybe money for their data. They rather would like the data to be used properly, ethically, and safely. So I think that this, from at least my perspective, for also this My Data global community that I'm also representing and coming from, the ownership is just that when you transfer the ownership, you basically lose the control over your data, and that's maybe some people accept that, as I said, but this means that you just give up on the control.
I think I think where I'm coming from here is that lawyers can have a great deal of fun with trying to understand what the ownership of data is. And around Europe, we don't have one jurisdiction that has a clear view, or indeed that view being harmonious across EU countries. Petra Wilson, who is a lawyer who I'm sure many of you know, thinks that we need to change the dialogue. We need to change the conversation from ownership to control, and to educate people that what they really need to do is to be able to access their data and control it, and control either sharing with it or who's accessing their data, and get away from the idea of ownership. Because at a simple level, when I talk about my health data, I naturally think it's my data. But and then that I make the leap to thinking, well, that's the legal position, but it's not. And we need to change the dialogue, change the conversation as part of the education process around this whole use of health data and sharing health data. But where I'm interested, where I think that takes us, and perhaps this is a question for Dipak and some others, is that Digital Health Europe's proposing the idea of a contract for the use of health data and sharing, and how, and indeed a global contract. And I think what it's picking up on is that there isn't one agreed set of principles or terms, if you like, that people access any data globally. And then it's a bit of a wild west in terms of Google decides what terms it's using, Facebook decides what terms it's using. Can we just have a conversation about how we think that this idea of a contract might develop?
Bleddyn, I'm happy to come in on the topic. I think I must quickly say, though, that DHE is not as a project coming down firmly to propose a particular solution at this stage. So contractual terms is a topic that we're exploring, but we're not endorsing or proposing that this should be the right model. I'd like to just go back, though, first to the topic of ownership, and to throw in a little analogy for you. If you, Bleddyn, were to borrow €100,000 from a bank, and the bank opens a record on you, which includes your credentials and why they've trusted you with the money, what the terms are for repayments and so on. This is data that is absolutely personal data about you. It's even probably special category data under GDPR, I'm not sure. But do you think that you own it and that you can go in and grab it and take it away, and thereby the bank no longer has any evidence that it lent you money, and that you can just say, it's now mine, I'm taking this file. If it was a paper folder, you would be able to just grab it off the shelf, run away with it and say to the bank, bad luck, you're not going to get any money from me now. You've got no proof that you ever lent me any money. Is that what we mean by ownership? Because if so, we're not going to be able to persuade anybody on the planet that that's how health data should be treated. It's not a smash and grab thing. Ownership is an unhelpful concept. Control is absolutely the concept. And what we are seeing increasingly is that where health data started life in a relatively minor ecosystem, where single healthcare organizations initially, if you go back more than 100 years, single individuals kept their own personal records on what they'd seen and treated you for. We're moving to a stage where data has massive utility, and where the people who are wanting to be able to make use of it are less and less close to the patient, less and less even for using it for purposes that the patient will directly benefit from. Example, a patient has a terminal illness. They are not going to be cured, but their data can be used to help find a cure that can only ever be used for other patients, but never for this patient. Patient is not a direct beneficiary of their data use, but when you speak to patients about that, they want that to happen. It's their decision. The challenge with these words I can see on screen, citizen-centered and citizen-led, are how do we deliver that? What do we mean by those phrases? A lot of surveys have run with questions that say, would you like to decide? Would you like to be in charge? Do you believe, you know, Amazon should make a decision about your data, or you should? And of course, when you put superficial questions like that, the answers that you get from surveys are obvious. The question becomes, if the spirit that we all want to uphold, which I believe almost all of us do want to uphold, is that where people's data are concerned, irrespective of the red herring of ownership, how do we enable people to be well enough informed that their views can be taken into account? And that, of course, goes back to the digital literacy question, because informed decision-making means informed people. But until we inform them properly, they can't easily decide accurately. Are we also talking, when we talk about control, you know, a lot of people think, oh, it's an app on my phone. Every time somebody wants to use my data, they have to ask me, and I say yes or no. And that is just so unscalable, it's untrue. So the question becomes not, do we want the spirit of citizen-controlled, citizen-led, but what do we mean by that as a practical, realistic way of delivering this at scale? And that is where I think we fall apart when it comes to how we deliver that. That's the kind of discussion DHE is engaging in. What are the terms whereby people might agree collectively rather than individually? And then to turn to one of Carina's recommendations, you know, we need a lot more experimentation on models. What are the models for delivering the citizen engagement in decision-making? What's the granularity that's realistic? Open for discussion, but these are the hard questions that we need to focus on, not the kind of superficial ones that unfortunately easily fall out of the surveys.
And I'm guessing that in order to do that, we needed it at scale again, and we need to.
It's got to be scale.
Yeah, and we need to engage the public in a way that countries have shown little appetite for in the past. I mean,
we need each person's data to be potentially usable for research about 30 to 50 times a day across different purposes, different actors, different situations, different parts of their data held in different places. And we need to say, well, what would that look like as a mosaic of requests? Would you really want to subject somebody to 30 texts a day? You know that when you get the terms and conditions for downloading an app, and it's 8 pages, because I mean, informed consent means 8 pages to describe the research. Who's the, you know, what's the data going to be used for? Who's the data controller? How do you make complaints? How do you, you know what it's like filling in a consent form. You know when you download 3 apps in a single day, even if you ever do, the third one, there is no way you read the terms and conditions. So we're going to get uninformed, knee-jerk reaction if we do it in the wrong way. So I would prefer to see us really exploring scalable, practical ways. How can 6 million people respond to 30 requests a day and give rise to scientifically valid, non-biased responses? Because you want non-biased data. We say for AI data must be non-biased. Well, we're going to get huge amounts of selection bias if we ask 6 million people to make 30 responses a day.
Yeah, and this is where we hit some issues around GDPR, isn't it, in terms of informed consent, where in theory you're requiring individual consent if it's personalized data that's being required. But what do the rest of the panel think? Any other responses to some of the points Dipak's made?
I think what Dipak have mentioned, I think it is a very important topic, and I think it connects with the topic that we mentioned in the previous session about the digital literacy. Because if the citizen and the patients don't have the full capacities and the competence to make use of these tools, not only in terms of the user experience, but as well to understand what is going to be the data flow. If I trust in the provider, if I trust with the owner of such application, I think it is a very important momentum. So I think for that, some of the examples that Anna have showed to us with the Horus project that was funded in the project, I think it is very important that we really be local in order to be global. So in this way, to really to tackle and to targeting specific initiatives at the local level, in the healthcare institutions, in the municipalities, and on the educational side, in order to really to raise awareness between the community and really to be capable in the next upcoming years to make use and to unlock this potential of the data. So this is at least my perspective.
To follow up on Diogo's point, Dipak, I understand what you're saying in terms of it being extremely difficult to do. However, I do think that's going to be part of the evolution of where we are going to go with this platform economy we have. We've already made some incredible leaps over the last 20 years, just having platforms such as a Facebook or a Google that go across national boundaries and make it extremely simple for someone with I mean, my son is in 3rd standard here and he uses Google better than I do. So there is a simplicity to how things have been designed because they're economically driven. I would argue that that consent process, which has been made very complex, will also have to go through the user experience process and become simplified. There's just not an economic incentive to do
I think you're talking about the delivery mechanisms, and I agree they can be really easy. The problem is, if it's an informed decision, you can't get away from the fact that people need to know what they're saying yes or no to.
Oh, absolutely.
And that part, at the level of every member of the population across a spectrum of educational and cultural perspectives, ages, it's really hard to deliver that at scale. And we actually don't do it in almost anything else.
I fully agree.
We operate by means of a granularity process. You elect a president. How delightfully you do elect a president, and then you say for 4 years, you run with the country. We'll be delighted, as I know you do, and you're about to make a fresh choice. Actually, very, very close in a few days. I mean, that's at the absurd end. And I'm in the country I'm sitting. We've made a 5-year choice, and we are taking our deep breaths in exactly the same way as you are, perhaps. So that's at I'm going to say the worst case scenario is you make one choice and that person makes universal decisions for N years. But what we need is to find a granularity in the middle. For example, do people say, I'm happy for all of my data to be used for the following categories of research, but not others? Do we say, I'm happy for my data to be used for these purposes and not those purposes? Or I'm happy for my hospital data to be used, but not my personal data, or I'm happy for my personally collected data, but not my hospital. So we need a coarse-grained mechanism that makes it scalable for real-time decision-making about data release at a level where, hundreds of millions of people don't get multiple requests a day.
I fully agree with everything you said. I think the danger that I've seen on our side of the Atlantic has been people have made the assumption that because current systems are not transparent or don't make it easy for people to understand, that the decision can be made for people. I've been in discussions with some of the,
and I think that also invites another question, though. And again, I don't think this panel is going to solve the questions. I think we're airing them. Is about a priori, a posteriori. What I mean is, do you lodge up front some personal profile, or maybe you don't lodge a personal profile, you indicate agreement that a body that has been appointed that you are willing to trust is making all the decisions, and all you're doing is making a Boolean yes, no, I'm happy to trust this body, or no, I'm opting out. but that's the a priori part. In advance, you say, go ahead. Then
Yep.
in arrears, every month or every 3 months, you can go onto a website and see the decisions made and change your mind based on what it's done. Maybe that's the model that's more realistic. But these decisions about granularity, about the extent to which you delegate decisions to a body, the extent of transparency, these are where I believe we need to spend our energy exploring societal comfort, exploring pragmatism.
We've been exploring a combination in the sense of doing an a priori similar to a living will, where people will be interviewed in a much longer period of times where they hopefully are not afflicted in any way, where they can make a decision as to how their data will be used. But at the same time, that ends up being revisited annually, similar to a living will, so that if people's opinions or choices are different, that can be reflected and recorded. I think we can't ignore the danger of the other option, which is if people feel that they're being disrespected or their choice isn't being listened to, that they withdraw completely. The black box aspect of that, especially from an AI perspective, could be catastrophic. So,
well, let's let some others come in, because I feel a bit guilty that you and I have had a bit of a dialogue, although it's been really interesting. I think what we've explored here is parameters of the trial and error bullet point on that slide. Here are some of the parameters that need to be explored. But Bleddyn, I think we should let you push some others.
Yeah, Mara had a hand up. Mara, what were you? Over to you.
Yes, I was trying to pick on what Dipak was saying about the willingness to share the data, and that the patients could get a 30 message a day or that. But maybe we should show them what happens with the data. We should show them that is a new treatment, it's personalized medicine. Maybe it's not for them because, like you gave the example, they are in a terminal ill, but it's for somebody else. Showing that creates a part of the trust. Showing where we keep the data, like we all discussed here, it's the other part of the trust. And showing who is managing the data, it's the third part. For example, we all take all the medicines that they are, and we use all the medical devices because they are stamped by EMA or FDA. Maybe we should have a body like that, because we live in different countries with different systems of security or system of people trusting the government. So I live in Norway, but I'm originally from Romania, and I lived also in Spain. So I can see the trust between the people and the government. So if I will be to share my data with, and I know that it's in the hands of the Norwegian government, I will be happy. If I know that it will be in the hands of another government, maybe not so. But if we have a body that can say, because we live our lives, we go to the hospital and say, use all the devices that you have there, and they have been stamped by the EMA or FDA or other authorities. So I think it's a lot of things that we, Europe, the States, or and together with advices from people like us, have to sort how we do this for the citizens. But again, I advocate for show the citizen, show the patient, what do you do with the data and what's the impact of their data. So impact in the real treatment, real personalized medicine, and so on.
Yeah, I absolutely agree. And I think one of the things that we've been hitting on with this conversation is that this is cultural too. So in Finland, there is a great deal of trust in the government. So the reason that Kanta can work is because fundamentally the Finns trust their government. Now, that isn't true in all places, not least of which is because we constantly read about data breaches in financial services or in government with tax records and so on. And that's a problem. I'm conscious that we are exceeding our time, although we did start late, but there's just one thing I want to wrap up with the panel on. Oh, Carina. Yeah.
Just for the 2 minutes I was able to connect. I'm very glad that Karolina did a great job replacing my presentation. But just because of what Mara was saying, just to highlight that today this was not under discussion, but indeed one of the recommendations of our work was exactly on the creation of this international body that oversee all these issues in a way that is transversal to governments, which is of course a very good point. So this will be discussed further in the My Data conference in December, and probably also in the Digital Health Summit, where we have also a panel. But I think this is something we could also move on and further discuss, because for sure it's a very nice highlight and a point to keep. So
yeah, count me on. Count me on. We haven't talked about this on our WhatsApp, but you see, our minds are connected.
So one of the things I just wanted to just finish on, if you like, very quickly, was that primarily because we've got a new commission and we've got lots of policy debates taking place, there's been a great many events around health data in Europe, and as well as somewhere like Digital Health Europe, which is fundamentally about a European project. And I'm just wondering what people's views are about how we take this forward so that we don't lose momentum, and actually how we see some implementation of some of the really great work that is taking place. I mean, Dipak and I are doing something around industry and some of this agenda. And I'm just getting, and I feel for some of you, how you think that we can progress this positively. Over to any of the panelists. Oh, it's obviously a difficult question.
Well, finding maybe what we are already doing, which is to say many times similar things or connected things in several different places is already a way to move forward. But for sure, it would be good to have a broader agreement between different types of stakeholders and to have some encouragement to progress on some more formal policy and bodies, as we were discussing before.
And DHE is producing, obviously, and publishing its work. So there is going to be good materials as a starting point around the discussions that we've been having this morning. So that's the sort of minimum. But I'm just wondering whether we think that there's an opportunity for some of the organizations to collaborate more practically going forward. Well, one of the things that I'll leave us with then, if no one else is going to jump in, is that the Digital Health Society, which ECHAlliance helped form for the Estonian government when it had the presidency, is trying to pick up with successive presidencies in Europe interested in digital health, implementation and actions. And we have a summit next month where we'll be presenting some of the work that Dipak and I have been involved in with some commercial sponsors. And I think that we need to keep alive to working together, collaborating, so that some of this information and reports just doesn't gather dust on shelves, and actually we reach out to each other and see where we can help each other from time to time. So with that, we've exceeded our time. So I'd like to thank all of the panelists for their time this morning and for the interaction and the questions. I hope everyone's found it helpful, and please check out the breakout rooms for the documents. So thank you very much, and that ends this panel.
Thank you so much, everyone, for this so interesting conversation, and Bleddyn, for your leadership of this session. I am so sorry that Carina could also join in the end, but as we say, never better in the end than never. So pleased to have this great panel as the opening of the Health Data Forum. So it's incredible to see that we have also participants from the US who joined by phone. And we are becoming really a global hybrid summit. That's our goal, yes, establishing bridge also between the US, Europe, India, and other regions in the world. It's really important because the world now is becoming a small, very small village. And if we had doubts in a few years ago what happened in China would never affect us, So check out the streets and see everybody wearing masks. And that's the reason why we need to cooperate immensely. I fully agree with your conclusions, Bleddyn, and I would like also to point out here to show up the Digital Health Europe website, which is an incredible initiative that is the living proof of how the European civil society and even the European Commission, because in the end it's European Commission that wants to have an active civil society. I think that probably the missing element we have now is the national government. So national governments needs to wake for a new reality, and that's what we here in the Health Data Forum are going to be able to offer this venue for you, civil society, researchers, practitioners. Please use our forum to extend your agenda into what needs to be done in terms of health data and our future. So thank you so much, everybody, for this opening session. I hope that you can stay along these 3 days. There are going to be plenty of activities, plenty of other meetings in this Kiko chat. Hopefully, Carina, you'll be able to sort out your problems. I think we are escalating this already to Zoom already to see what's going on here on this situation. But thank you so much. So this session is being recorded. It's going to be published on the Health Data Forum YouTube channel. So stay around, and also don't forget to meet in the bar. We have a pub and we have also the beach. So it's 2 new interaction spaces that you can try for yourselves and enjoy. Thank you so much. There's now lunch break and back at 2 o'clock UTC.
Goodbye.
Thank you.
Bye.
Bye.
Thank you, everybody.
Bye.
Goodbye, everyone. Goodbye.
Bye.
Thank you.
Thank you.
Boas tardes, Ana Luísa. Muito obrigada pela sua presença. Eu acho que já confundi um pouco fiz há bocado uma observação, mas era para a sua colega, para a doutora Juliana, que eu acho que fez a observação dos currículos, ou foi a Ana Luísa?
Fomos as duas. Aliás,
foram as duas, ok.
Acabamos por complementar as duas.
Complementaram as duas, então está correto, está bem, está bem.
Obrigadíssima, doutor. Obrigada.
Ora essa. Hi, Lucas. Hi. Finally, we sorted the problem of Carina Dantas, but it was so complicated.
Very good. Well, would you like to stop the recording and then I can...
Oh, yeah, please, let's stop the recording. Yeah. Whoa.